and things that will help me be stronger.
Working here as a volunteer is a good way to get to know your community. It's a good way to learn how to work as a part of a team.
They're people from our community, so they know and they have a heart for our community to step outside of our comfort zone and do more.
Don't be afraid, because this is where you're going to gain the most valuable experience that you can use in your future.
I encourage everybody to be a volunteer at Rogers TV because not only do you grow professionally, you grow personally as well.
This is Rogers TV, New Brunswick.
It was my daughter's birthday. She was blowing out the candles on her cake when we heard coming from the TV. So we stopped and listened, and it helped us get to safety. That's why when I think of my daughter's birthday, because now she gets to keep having them.
I'm Craig Eagles. I have the honor to showcase New Brunswick's finest athletes and builders on Sports Inclusive. We take a look at their personal journey and how sports has impacted their lives. Sports Inclusive, only on Rogers TV.
This is Rogers TV, Fredericton.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, la Dr. Jennifer Russell, et le Premier ministre Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon, everyone. The COVID-19 pandemic is continually changing across the globe and here in New Brunswick. To meet this challenge, we must continually review and adjust our approach so that we have the best opportunity to slow the progress of the disease, flatten the curve, plank the curve, whichever phrase you want to use. And we must ensure that we have the resources, both material and human, to meet the demand. So we know that community transmission of COVID-19 has been found in New Brunswick, and that will likely mean that more people could come into contact with an infected person and become infected themselves. And what you're all wondering now is how long will this go on and when will this end? And the answer is not anytime soon. We do have some modeling projections that we're planning to present next week, and these are based on all different types of information from around the world, also from Canadian data and from our own data here in New Brunswick. But I know conversations that I've had with my medical officers of health in the last month or so revolved around what kind of predictions we could make based on the measures that are in place right now. So the closing of the Canadian borders, the closing of the New Brunswick border, and those types of things would allow us to have information around how many more travel-related cases would happen, and then how many community transmission cases could we try to predict. And looking at the incubation period being 14 days, we were sort of looking at the calendar thinking, okay, well, once these measures were in place, if you calculated 2 incubation periods, which would be about 28 days, that around that time frame, we would have a really good snapshot of what the situation was at that time. So in terms of how the physicians involved are looking at the numbers as they evolve, those are the types of things that they're keeping in the back of their mind. When did these measures get put in place? When did this social distancing get put into place? And what types of effects will we see, and what is the timing around some of those effects? So those are the conversations that the medical officers and I have had over the last month or so. So in the coming days, we are going to release our projections for the anticipated course of the pandemic, along with our health system plan to meet the demands it places on us. Because all of this modeling is really done to see what our healthcare system can absorb. So when we know how many hospital beds we have, how many ICU beds we have, and we put that together with modeling to project, well, what are the types of numbers that we would hope to not see this go above to be able to absorb and manage. Those are the conversations we've had. Those are the types of things that are taken into account when we're doing our planning. And BC had released its planning and projections around the pandemic to show, again, as the course of things go on, what type of resources they have in place, and will they be able to will they have the capacity to deal with it? So those are the same kinds of projections we have coming forward in the next week, and so that's going to be presented next week. So the demands will be significant no matter how this plays out. So whether our predictions are accurate or not accurate, we still will have to go forward and deal with this and adjust our plans as that happens. We are currently meeting the demand, and we are working with our federal partners to ensure that we have the supplies we need when they are needed. And again, those conversations have been happening at the national level as well with our counterparts across the country, because at the outset of this pandemic, again, we had our stockpiles in place. We had conversations at the national level about their stockpiles and having a scan of the lay of the land in terms of what our starting point was and what our hopeful destination points would be. And some of those things were not predictable at that time, including changes and disruptions in supply chains and production. So those are new pieces of information that we've had to take into account as the pandemic has progressed. So I share the concerns expressed by the Premier regarding our stockpile of COVID-19 test kits and other supplies. And having consulted with the working group that is involved in the laboratory testing and supplies in terms of procurement and the actual technical aspects of that, including the head of the microbiology department in Moncton, Dr. Giroir, I'm confident that we will have enough when we need it to meet the demand as long as we are prudent in our use. And up until this point in time, our approach has been to use the case definition, which is in line with the national case definition. And as the cases and the changes of transmission pattern evolves, then we change our approach for testing and take that into account as things move forward. And so that's why the 811 information and the way that we're referring people for testing, all the testing sites in place, these are all things that we manage together as we move forward. So this continues to be our approach in this fast-changing pandemic, and I am confident that our system can meet this challenge. And again, we will adjust as we get new information. So the federal government did say that they have a supply of arriving for us here in New Brunswick on April 6th. So we're happy to hear that. And again, that's new information for us to put into our planning. Today, there are 4 new confirmed cases of COVID-19 in New Brunswick, and this brings our total to 95. So the new cases are in Zone 3, Central New Brunswick. There are 3 new cases, aged 30 to 69. And in Zone 5, Campbellton region, there is 1 new case, an individual aged 30 to 39. Aujourd'hui, j'annonce qu'il y a 4 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick, portant le total à 95 cas dans la province. Les nouveaux cas sont répartis comme suit. Il y a 3 nouveaux cas dans la zone 3, région centrale du Nouveau-Brunswick, soit les personnes âgées entre 30 et 69 ans. Il y a un nouveau cas dans la zone 5, région de Campbellton, soit une personne âgée entre 30 et 39 ans. As I said yesterday, it is really important to think of these cases as not just cases, they're people. And I did have a message from my medical officer of health who's in the North region, Dr. Paquette, because she is concerned about what she has heard in the community, and others have commented on around whether or not a person was tested or diagnosed in a certain region and where they choose to self-isolate. So a person can be tested in a region, they can get diagnosed in a region, but that may not necessarily be where they choose to self-isolate. And again, for confidentiality reasons and out of respect for the people that are dealing with this, because I can tell you that anybody who has COVID-19 is concerned about their well-being. Their family members are concerned about them. Will they become hospitalized? How seriously will this illness affect them? And so there's a lot of anxiety and a lot of stress around this. So we do have to have compassion and we do have to have kindness around how we communicate with each other around people who have COVID-19 at this time. And they do need our support. These are our neighbors, our friends, our fellow New Brunswickers. They have homes and families and friends and loved ones and whose lives have been dramatically altered by this disease, and they deserve our compassion and care. And our testing protocols from the beginning have been based on the simple premise: find those who are infected with COVID-19, especially those at high risk of infection, and then find those who may have been infected by them. Dès le départ, notre protocole de dépistage a été fondé sur un principe fondamental: trouver les personnes infectées par le COVID-19, surtout celles à risque élevé, et ensuite trouver les autres que ces personnes pourraient à leur tour avoir infecté. Et par risque élevé, ça veut dire au commencement, c'était définitivement des cas de personnes qui ont voyagé en hors du Canada. Et après ça, le risque a changé pour inclure les gens qui ont voyagé en hors du Nouveau-Brunswick. Alors, au fur et à mesure que les risques ont changé, la manière qu'on teste a changé aussi. And the other thing about where people self-isolate and where the cases are, it really is still important to remember that no matter where you are in the province, you have to act as if you already have COVID-19 and that there already are cases. And you have to, again, follow the information and the recommendations around staying home unless you have to go out for necessities. In the early days of this outbreak, just a few short weeks ago, our testing focused on those who had traveled internationally, and later we began testing those with symptoms who had traveled outside of New Brunswick. And most recently, we adjusted our testing criteria to include symptomatic workers in our healthcare system regardless of travel history, as well as hospital patients and nursing home residents showing symptoms. And again, this is from guidance from the Public Health Agency of Canada, because we know the evidence is there to show that when you have an institution like a hospital, like a nursing home, the way that the cases can get transmitted, it can happen very rapidly and a huge number of people can be affected. And so that is why we definitely need to minimize those types of cases. This was a crucial step to prevent COVID-19 within our healthcare facilities. So last month, I met with our regional medical officers of health who are on the front lines of this disease. We talked about how and when we would see a clearer picture of the measures and if they were working. So keep in mind that New Brunswick took actions to slow the spread of the disease, such as stay-at-home orders, closures of public venues, closing of the borders, etc., an earlier stage of the pandemic than many other jurisdictions. And we applied the lessons of their experiences. So we knew that once international and provincial border restrictions were in place, there would be about 14 days as returning travelers self-isolated and were tested and symptoms emerged, and then another 14-day incubation period to determine the degree of community transmission. So once we see that those timeframes evolve and we see what kind of transmission we have, we will be in the phase of knowing, again, where we are in our pandemic and what types of plans we need to adjust for with that new information. And again, it will tell us how successful those early countermeasures have been. And again, I said yesterday, I'm hopeful, I'm optimistic, but there is also the reality of what is the new information that we will get as time goes on. And we have to be ready for new information. It remains crucial that those who have traveled and have been directed to self-isolate continue to do so and monitor themselves for symptoms. While the majority of cases we have seen to date are directly or indirectly related to travel, we cannot afford to take chances with this virus. I want to personally thank the staff at our microbiology laboratory at the Dr. Georges Dumont Hospital for their tireless work to date. I want to thank my regional medical officers of health, the public health nurses, the public health inspectors, the entire team at the Office of the Chief Medical Officer of Health, and the entire team at EOC, and all of the representatives throughout our healthcare system. Everybody is working so hard right now, and I really, really want to thank them, and I really appreciate everything that they're doing. I also had somebody reach out to me to talk about essential workers and to thank them. So somebody from a banking institution wanted me to talk about thanking them, and I do agree that we have to thank the people that are working in grocery stores. I have friends who have teenagers working in grocery stores, and they say that, you know what, not everybody's being polite and kind. So we really have to try to increase our patience and our ability to have compassion for the people who are out there every day helping to make our lives better. Je tiens à remercier personnellement les membres du personnel du laboratoire pour le travail inlassable qu'ils ont effectué jusqu'à présent. Je les remercie également d'assumer cette charge de travail supplémentaire. We must maintain our focus on testing the most vulnerable and to protect those who protect us. This means that testing healthcare workers, the elderly, and others in critical need. Testing has been and continues to be available to any New Brunswicker. If you have symptoms, your family doctor or nurse practitioner can refer you for testing if they believe this appropriate. And again, if you don't have a family doctor, there is a virtual website, it's called eVisits NB, and so that's another option for virtual care in the province right now. And I want to emphasize that if you believe that you have the symptoms of COVID-19, you must act as if you have COVID-19, and you must self-isolate and act as if you are infectious. And again, the best way to ensure that we can test those who we need to test and manage our material and human resources is for everyone to do what they can to avoid contracting or spreading this disease. And that means staying home as much as you possibly can. And I know there was some, I saw somewhere recently about, I think it was the World Health Organization website was saying, show us what you're doing while you're at home. Inspire others with what you are doing at home, because these are very difficult times, very stressful times, and it's affecting people's mental health in a very large way. So again, we're very sensitive to that. We have some mental health resources on our website that we would like you to visit and explore. But I saw on the World Health Organization website was to videotape. That's aging me. Get a video of what you or your family members are doing at home to get through things and raise your spirits and keep you staying positive. Je vous rappelle à tous que la meilleure façon de nous aider à répondre à la demande en matière de dépistage consiste à prendre toutes les mesures possibles pour ne pas contracter ni propager cette maladie. Cela signifie que vous devez rester à la maison autant que possible. So that means keeping your interactions brief when you do go out and maintaining that vital 2 meters of physical distance between yourself and others. And I want to compliment the businesses out there who have already put that into place. I think the workers who work in those environments feel much safer, and I can tell you that the patrons of those places feel much safer. So thank you to those businesses who have done that already. The slower that COVID-19 is spread, the better able we will be to manage the testing process, and that in turn will further slow the progress of the disease. And when will we reach the peak of this outbreak? I don't know that today. But what we do know and what we are doing right now is to delay the peak. We are trying to flatten the curve. We're trying to plank the curve. So all of the measures that are in place are really around, let's not find out that the peak is sooner rather than later. Let's delay it as long as possible, but the only way to do that is for us all to work together. So we need to flatten that curve, and we need to protect our healthcare providers so that we can deal with the burden that COVID-19 is placing on them. And this is in your hands, so keep your hands clean. Merci. Thank you.
Good afternoon. Bonjour. The situation with COVID-19 is unlike anything we have dealt with before, and it is constantly evolving. What hasn't changed is our goal to keep New Brunswickers healthy and safe. Pour atteindre cet objectif, nous disons aux gens de rester à la maison, et nous allons continuer de le faire. Mais nous disons aussi aux gens de sortir dehors et de faire des exercices. Cela a causé une certaine confusion, mais il est possible de faire les deux. You're able and encouraged to step outside for a breath of fresh air. We all need that, but you must do so without endangering your neighbors. Whenever you're outside your home, you must maintain a physical distance of at least 2 meters or 6 feet from others. This is true whether you are taking a walk in your neighborhood or going for a run along a trail. Social gatherings are not allowed, inside or outside. Swimming pools, soccer and baseball fields, campgrounds, and golf courses are prohibited from admitting patrons. As well, every landowner must take reasonable steps to prevent social and recreational gatherings. While I understand that people need to get outside, they must remember there are rules in place, and when they are out in the public spaces, they must follow the rules. Visitors must follow these rules and maintain proper physical distancing. Tous les parcs provinciaux sont fermés jusqu'à un nouvel ordre. Et cela inclut les sentiers situés dans les parcs provinciaux. Les parcs et les sentiers municipaux peuvent rester ouverts. Mais les municipalités doivent avoir des mécanismes pour limiter le nombre de personnes qui peuvent se rassembler dans cet endroit. Appropriate signage must be put up at access points to identify limitations on gatherings and the requirements for physical distancing. If your municipality cannot monitor usage of the premises should be closed. I wish to thank all local mayors and councillors for their support and diligence to ensure their communities remain safe. All playgrounds have been closed in New Brunswick. Everyone must respect these important restrictions and keep children away from any playgrounds for their own safety. Des panneaux appropriés devraient indiquer les fermetures. Des rubans devraient aussi être installés pour fermer l'espace lorsque c'est possible. Ces mesures supplémentaires ont pour objectif d'assurer la santé et la sécurité des gens de Nouveau-Brunswick. Public safety is working with municipalities to ensure there's compliance with the order. While we continue to work hard to face the challenges related to COVID-19, at this time of year, we sometimes face other challenges as well, such as flooding. We are starting to see some localized flooding in low-lying areas where overland flooding is historically an issue. Our New Brunswick Emergency Measures Organization and its River Watch partners are monitoring the situation and are ready to help. It's much too early to say what the freshet will look like. While no flooding is in the immediate forecast along the St. John River system, this time of self-isolation is a great opportunity to get ready. If you've experienced flooding before, it's important to take steps now to protect your property and your family and be ready in case you need to evacuate. As more information becomes available, we will share it with you. Il est très important de continuer à communiquer avec nos collègues du gouvernement à tous les niveaux afin de pouvoir travailler ensemble pour établir des programmes et des services qui vont aider les gens qui ont besoin d'aide. Quand nous constatons un écart, nous devons trouver une manière de le combler. That is why our government has introduced an emergency bridging fund for vulnerable post-secondary students in New Brunswick. Up to $500,000 is available through this fund to support vulnerable students who are directly impacted by the COVID-19 situation. These funds will be distributed by post-secondary institutions to students based on eligibility criteria and will provide a one-time amount of up to $750 per student. The fund will support post-secondary students in New Brunswick, including international students, who demonstrate a financial gap in meeting their basic needs between now and the end of the term. To qualify, vulnerable students must be directly impacted by COVID-19 crisis and must not qualify for the one-time $900 provincial emergency fund as of March 30th, 2020. They cannot have access to funds through student loans, employment insurance, personal savings, or other COVID-19 related financial assistance programs. Students must contact their institution directly to be considered and will be assessed on a case-by-case basis. All post-secondary institutions are encouraged to provide additional funding where possible. I thank those that are already doing so. This is not the only support in place for post-secondary institutions. Both the federal and provincial governments have announced a 6-month interest-free moratorium on student loan programs. Students may also be eligible for support through federal employment insurance, the increased goods and service tax credit, or the Canada Emergency Response Benefit. De plus, certains étudiants de niveau postsecondaire sont admissibles à la présentation de revenus d'argent pour les travailleurs de New Brunswick, une prestation unique de $900. Nous allons continuer à travailler ensemble pour offrir des programmes et des services et où les besoins sont les plus grands. Some confusion has arisen around the state of emergency and how it impacts tenants. People can still be evicted, just not because they can't pay rent due to COVID-19. All other tenant obligations remain. And if tenants try to take advantage of this, we will act. We will cause the law to be followed because this is no time to abuse either your landlord or the situation we're in. This is a time to protect those that need to be protected. If you are unable to pay your rent, you must contact your landlord to discuss this and to make arrangements on how this will be addressed once life returns to normal. We must all work together to help those impacted by COVID-19, but we must do so in a responsible manner. Traditionally, weekends are time when people relax. But as we go into this weekend, what cannot relax are the rules. The health and safety of New Brunswickers must be top priority, and we will do what is needed to enforce this. Prenez le temps de communiquer avec les membres de votre famille et vos amis grâce aux médias sociaux ou encore par téléphone. Et sortez prendre l'air. But continue to do so in a way that keeps you and your loved ones healthy and safe. We will get through this together. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci, Monsieur Premier Ministre. Dr. Russell. We will now proceed to questions from the media. Each reporter will have one question, and you can pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question, puis vous pouvez poser votre question dans la langue de votre choix. Kevin Bissett, Canadian Press.
Good afternoon. Mr. Premier, based on your conversations yesterday with the First Ministers and with the modeling released today by Ontario, does that change in any way what you'll be releasing as far as modeling and other information?
No, not really. We have, at this point in time, our caseload is such that we are working on a modeling for New Brunswick. We have done modeling based on the worst cases that we've seen around in other countries. And when I say worst cases, you know, I'm talking like Italy or in the case in New York. So we're looking at that and saying, if that happened here, what would that look like to New Brunswick? But we're looking at the number of tests that we're getting here in New Brunswick and saying, okay, what does that modeling look like so we can predict timing and to the best of our ability. That should be something we can do over the next week or so. And we would be releasing our modeling and our health plan. We've had several meetings. I mentioned that over the last few days. And then last night's culmination with my colleagues across the country and with the Prime Minister and Deputy Prime Minister only reiterated the timely need to have adequate supplies and resources, to have consistency across the country in relation to usage so that we are, we're in this together. And I have to add that, it's a humbling time to be a Premier of New Brunswick and to be involved in this at a national level with my colleagues. I would say there has never been, certainly for many, many years, a time when this country has acted so much like one nation. And it's what we always pretend to be, but never before have I experienced it like I've seen it in the last several weeks. And I believe that it's going to be something that's going to make us much, much stronger at the end of the day.
Thank you, Premier. Michel Corriveau, Radio-Canada.
Bonjour, merci. C'est une question à la fois pour Dr. Russell et pour le Premier ministre Blaine. Le Premier ministre hier disait à CBC qu'il manquait de tests d'ici quelques jours, si on augmente la quantité de tests. Or, on sait que, on entend parler du fait que plus on teste, plus que ça va être possible de limiter l'augmentation du nombre de cas. C'est une façon d'agir. J'aimerais avoir les commentaires là-dessus. Qu'est-ce qu'il y en a exactement?
Alors, bonjour, Michel. Alors, les commentaires que le Premier ministre avait donnés hier au niveau les ressources, c'est vrai qu'au niveau fédéral et dans chaque province, c'est vraiment important de nous rendre compte de qu'est-ce qu'on a dans nos réserves et qu'est-ce qu'est la possibilité de commander d'autres. Alors, nous, maintenant, on a une commande qui va arriver le 6 avril. Alors, ça, c'est des bonnes nouvelles parce qu'à ce moment-ci, on avait 3700 tests et aussi 4900 je ne sais pas comment dire en français, c'est la chose qu'on fait les échantillons avec. Alors ça, dépendant combien de tests qu'on fait par jour, ça nous donne un tel montant, mais maintenant qu'on a une autre, ils vont nous envoyer d'autres le 6 avril, ça c'est des bonnes nouvelles. Depuis le commencement de l'éclosion de la pandémie, on est toujours changé nos critères pour faire des tests basés sur les directives et les directives de l'Agence de santé publique du Canada, fur et à mesure que les risques ont changé. Alors, il n'y a jamais eu un moment durant la pandémie, ici au Nouveau-Brunswick, que les gens qui ont eu que c'était nécessaire d'avoir un test, qu'ils n'ont pas eu un test. Alors ça, c'est pas une réflexion de les nombres de tests, mais tout simplement pour faire sûr qu'on suivi les définitions de cas et les critères qu'on devrait suivre à fur et à mesure que les nombres de cas changent et la manière de transmission change. Est-ce que ça répond à la question?
Oui, ça répond. J'ai l'impression. OK. Est-ce que le Premier ministre avait des commentaires sur ces commentaires d'hier?
Yes, certainly I do. In relation to the number of tests, and my comments are that if we were to increase our testing to 1,000 a day, then we would have like 5-6 days of materials available and test and reagent and test supplies. And we are currently running at 400 to 500 based on the criteria that has been set out by the public health officer. And in doing so, we've met the criteria, but ramping it up means we need more supplies. That's been a conversation federally that I've been having. That's why I talk about consistency of supply, consistency of use, consistency of testing, so that we can provide the same standard. But I think it's very important to point out an extremely relevant aspect. We have reacted and made changes to protect citizens regardless of the testing results. We didn't wait for a test in order to start closing schools down, and we didn't wait for a test in order to start to restrict borders or movement around the communities, or then to implement isolation and or implement the Emergency Measures Act. We didn't do any of that based on the results of a test. We did that because it's the best practices that have been utilized around the world. So if we'd have taken a test, or whether we hadn't, we would have put these situations and these restrictions in place to protect the people of this province. So the only risk in doing any of this early is the patience of individuals that are isolated, and the requests we're putting and restrictions on individuals could be, elongated, and they get restless, and the weather gets better, and they think it's time for me to get outside and go visit my neighbors. So yes, we may be requiring more patience, but there isn't anything we'd have done differently to protect our citizens, and we'd certainly do it again.
Thank you, Premier. Vicky Hogarth.
Thanks, Bruce. My question's for the Premier. I know this was touched on a little bit, but Premier Doug Ford is revealing best and worst case COVID-19 scenarios for Ontario today, and he says he wants the citizens of Ontario to know what he knows. What's your take on this approach?
Absolutely. I agree, and we're putting data together. I had made reference earlier about we've done analysis based on worst case scenarios, and worst case would be countries that we've seen that has exploded around the world in terms of caseload. We're now using our data, and the more data we have, the better and more accurate our predictions will be, that we will actually be able to model what we see in New Brunswick, and that's kind of, we hope to be in that position within a week's time. Then we'll be in a situation that we can not only reflect our capability of our hospitals and our health plan to deal with it in the worst case scenario, but we can also be in a position to predict what is the New Brunswick scenario. And I would like to think in roughly a week's time, it kind of depends on, but that's our goal. And our goal is to be able to introduce that along with our modeling plan in the coming week, I should say, but certainly within the couple of weeks at the outside.
Thank you, Vicky. Monsieur Cameron.
Oui, ma question s'adresse au Premier ministre Blaine Higgs. Bon, avec la question de Michel Corriveau, vous l'avez un peu mentionné tantôt avec notamment la réponse de Mme Russell et votre réponse, mais j'aimerais que vous répéteriez en cas où il y aurait peut-être une petite augmentation de nombre de tests de dépistage. Est-ce qu'il manquerait de tests de dépistage à court terme, ou ça serait plus à long terme qu'il manquerait des tests de dépistage dans la province? Je ne sais pas si vous comprenez ma question.
Yes, I understand. The only issue that would arise might be some delays in the testing as opposed to missing any tests. So as Dr. Russell expands the framework of the testing, and we have capability right now to expand, and as she pointed out, we have a delivery anticipated for April 6th. If the scenario would be, it might delay testing if we got to that point. But right now, we have the capability to increase testing and increase it significantly based on whatever criteria that is put forward. And it'll just depend to what level. And I say worst cases, it would delay testing, but we would still capture the need to test.
Thank you. Merci. Silas Brown. Silas?
Hi, Premier. Speaking about the spring freshet and the possibility of seeing flooding in the province here, I'm curious how evacuations would work as we deal with the current state of emergency, and especially around removing people from their homes and ensuring that they're in safe places, but also being able to practice physical distancing and not putting them at risk in that sense.
Well, I guess what I would say to that is that we engaged our emergency measures organization very early, and they've been part of this process for 2-3 weeks now, and have done their own modeling in how they would do the evacuations, how they would manage this pandemic if it gets worse in New Brunswick. But now they will integrate into their normal flood response how they would react if indeed they had to isolate people at the same time. So we have a very extensive organization that unfortunately has had more than enough experience in the flood situation over the last couple of years. So they've kind of got that one, nailed pretty good. And they're adding on the capability of dealing with the COVID crisis if indeed we have both. I must say that I'm really hoping and praying that we don't have both. We missed a few years on the flood side.
Thank you. Elizabeth Fraser, CBC.
Hi there. My question is for the Premier. We've asked repeatedly for any kind of projections. On Wednesday, actually, the Southern Region's Chief Medical Officer told Sussex officials the peak is expected to hit the week of April 21st. What can you tell us about that?
I'll pass that question to Dr. Russell.
Hi there. So Dr. Kim Barker is the Regional Medical Health down in the Southern Region, and I can tell you that she is as passionate as we all are about protecting the health of the population. And she is the medical officer who led us through the measles outbreak. So I have the utmost respect for Dr. Barker, and I do understand the context that she was speaking about this topic was really couched in all of the phrases that we have been using this whole time, that, there is no real perfect way to project what's going to happen in the future. And based on what we know about measures that we've put in place over the last month, and, counting incubation periods in terms of giving us more information to see where things are headed, this is an evolving situation. So she was speaking at an EMO meeting about the topic of, how do we think, what's the direction that we think things are going to go in. And it is very difficult to predict, but I do know where she was coming from in terms of what she was meaning in that conversation. But that was a meeting for the Emergency Measures Operations Group in her region. And I think that taking it out of context is challenging, because again, we're all on the same team, we're all pulling in the same direction, and we want the public to be aware of all the information that we have. So, but in terms of an idea of when things are going to peak, we're going to be presenting our modeling next week, and even after we've presented the modeling, it'll almost become obsolete right away as new information comes into play, which we will keep using to adapt our approach with the regional health authorities, et cetera. So it's an evolving situation, and I'm counting on all of my entire team to help get us through this, and I am counting on the media as well to help get our messages out in terms of what the public needs to know to protect themselves, for us to all feel that we have some control and some power in terms of protecting our health and protecting the health of our loved ones.
Thank you, Elizabeth.
And just very quickly, what is your advice to people considering going to their cottages to escape possible transmission of coronavirus in urban areas?
Elizabeth, we'll save that if we have time for follow-up. Geneviève Normand, Radio-Canada.
Oui, bonjour. Ma question est pour la docteure Russell et ça porte sur un sujet assez spécifique, c'est sur les accouchements. Parce qu'il y a plusieurs femmes enceintes en ce moment qui sont craintives, qui sont anxieuses à l'idée de devoir aller à l'hôpital, là où on traite entre autres des patients atteints de la COVID-19. Alors, ma question est un peu en deux volets. D'une part, comment ça se passe les accouchements dans les hôpitaux du Nouveau-Brunswick aujourd'hui et quel est votre message aujourd'hui pour les femmes enceintes?
Alors, si moi j'étais enceinte aujourd'hui, j'aurais les mêmes craintes parce qu'on sait que quand on est enceinte, notre système d'immunité est baissé et minimisé, diminué, ça c'est le bon mot. Alors, les avis pour les gens qui sont, les madames qui sont enceintes, on dirait maintenant, c'est rester à la maison autant que possible. Parler à votre médecin, votre obstétricien ou sage-femme de la possibilité à remplacer les rendez-vous avec des appels téléphoniques ou vidéoconférences. Éviter de recevoir des visiteurs maintenant à le domicile, laver les mains, pratiquer l'éloignement, etc. Pour l'accouchement, les craintes au niveau d'aller à l'hôpital, ça c'est les plans présentement pour les accouchements. Je ne crois pas qu'il y a des changements maintenant, mais au niveau de la transmission, on sait qu'il n'y a pas de preuves actuellement pour la transmission entre la mère et l'enfant durant l'accouchement, mais certainement avoir des conversations avec leurs médecins au sujet des craintes et au sujet des problèmes qu'ils croient qu'ils vont peut-être prévoir pour l'accouchement. Ça, c'est des choses que j'encouragerais les dames pour avoir avec leurs médecins.
Merci. Thank you, Doctor. Callum Smith.
Hi there, my question is for the Premier. Premier, I'm wondering how many people have been approved and how many people have been denied for the $900 emergency benefit? And on that note, what supports have been put in place for people who aren't able to work or have had to leave their job without a layoff notice due to child care concerns?
Well, currently, I think we've had about 54,000 applications, and I think the number is around 15,000 have been approved, if I'm remembering the numbers correctly, but 54 is the number that comes to my total. And your second question was in relation to other avenues. The second question, repeat that, please.
Yeah, just essentially what supports put in place for people who had to leave their job without a layoff notice as a result of child care concerns.
So in that situation, we basically have a place. We have either our own program, the federal program. If anyone has left their job because of a COVID-related item, which would mean if they had to stay home and look after their children, they would qualify for the federal program. And so our $900 is something as an interim there, but they would qualify for the federal program.
Thank you, Callum. Andrew Waugh.
Thank you. My question is for the Premier. So, Premier, last night when you were on TV, your language about the testing supplies got a lot stronger than it's been on these daily press conferences. And today, unless I'm wrong, I think I heard Dr. Russell say we have about 3,500 tests available until April 6th. But you're saying we can ramp up. How are those two things simultaneously true?
Well, this is the third. We're currently doing about 400 or 500 a day. And so if we're saying 3,500 tests, that would allow us to do between now and the 6th about, what, 900? So that would be ramping up.
Matthew Waugh, Como. Monsieur Como.
Oui, bonjour. Ma question est pour le Premier ministre Higgs. Hier, le Premier ministre du Québec, François Legault, a demandé aux policiers de tout le Québec d'être moins tolérants contre les gens qui ne respectent pas les directives. Quel est votre message pour les policiers du Nouveau-Brunswick?
Well, the same applies here in terms of respecting guidelines. I mean, I know that in Quebec, they have basically restricted movement in the province. Within Quebec, they've asked people not to move between the different regions. And we are trying to harmonize our efforts between our border because we do have essential services moving back and forth, people that are employed on either side. So, I think we're aligned in that regard. I don't think we're out of sync. And as we have more of the routine movements that are happening, we're in a position that we actually are able to, let's say, focus on the abnormal traffic and deal with that.
Thank you. Laura Brown.
Hi there. For either of you, I'm wondering if the shipment coming next week includes PPE, and once you receive it, will community testing ramp up? Like, is it not just the criteria that's currently today? Will the criteria, I guess, expand?
Sorry, Laura, that was about the personal protective equipment?
Yeah, so is the shipment coming next week, does that include both the testing kits, the swabs, and the PPE? And once you receive it, will community testing ramp up, as in will the criteria itself expand?
On the testing. So you can answer that on the testing.
Yeah.
Yep.
Yes, I would expect that, again, our criteria are continuing to change again as we look for community transmission and expect to see more of that. So definitely, we have the capacity now that we know that the shipment is coming, and we are ready to ramp up. So, but in terms of the criteria changing, if you called 811, it's still, that is a good source of referrals. And then also you can see your nurse practitioner virtually or your family doctor virtually or e-visits NB. And I think there are some walk-in clinics that are now virtual.
Thank you. Danielle McCready.
Hey there. I'm going to ask the question that Liz tried to squeak in. So what's your advice to people considering going to their cottages to escape possible transmission of COVID-19 in urban areas? Is that something that's okay to do, or what's your advice around that?
Well, I know in other jurisdictions they have been talking about trying to discourage people from going to those places for several reasons. One, obviously in smaller communities, rural communities with cottages and summer places, the hospital facilities around those areas would probably have a more difficult time in terms of meeting the capacity and also the distance in terms of ambulance drives. So, and then also increasing the areas of community transmission. So I know in other jurisdictions they are discouraging people from going to their summer places at this moment in time for those reasons.
So is that your messaging as well?
Well, I think it's important to consider all of those things because, again, we are a small province in terms of trying to maximize our resources to help get us through this this pandemic. So, again, I think there are risks to for people to move around in that way and to go to those rural areas.
Okay. Thank you.
Thank you.
C'est terminé.
Merci beaucoup, Monsieur le Premier Ministre. Merci, Dr. Russell. Thank you, Dr. Russell. Thank you, Premier Higgs. That concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci.
Length of the preceding program, we now join the regularly scheduled program already in progress.
Was paid on December 31st, 2019. However, the amount was only for $364,948.68 net of HST. This left a residual amount of $37,493.82. In order to properly account for the funds placed in the reserve for the fire vehicles, and in consideration for the province's continued contributions toward this fund, it was the recommendation of the Treasurer that this residual amount be returned to the reserve fund from whence it came for use on future fire vehicle purchases. As reviewed and approved by Council at the March 11th, 2020 Council and Committee meeting, this motion is being brought forward for formal adoption. Also, all allocations to or from reserve funds require motions of Council as per the Local Governance Act. Therefore, I move the following resolution of Council. Be it resolved that the Council for the Village of New Maryland transfer from the General Capital Fund, account number 06261020-875, to the General